suffer arthritis, injury to the cartilage, injury to the ligament, injury to the synovium, everything that can cause arthritis, either rheumatoid arthritis, either osteoarthritis or infection, or else that can cause inflammation to these through joints. Okay, talking about the forefoot means we are talking about the phalanx here, and the metatarsal. Okay, the patients complaining of the pain at the forefoot here. Okay, so let's see what structure that can cause the pain there. Okay, so to see the inflammation in the metatarsal area, we can approach from the dorsal side of the foot or from the plantar surface view. Oke, minta yang linear toh. Boleh minta alkohol. Di situ ya, Pak Mudi, tolong. Kesiniin aja, alkohol. Oke, thank you. Belum, ini masih nerangin ya Bu ya, belum. Kita mau lihat. Suppose we don't have ultrasound, that what I'm going to do if the complaint is just a week or so, then I will give medication only if the pain is severe. But then if the pain is not so severe, this metatarsalgia, even it is caused by bursitis, do quite well with rehab stuff such as giving insole, pad, giving exercise, stretching to the plantar muscles and tendon, and proper body weight, pacing, tell the patient how to, when to rest, when to walk, when to stand, proper footwear, something like that, so then the pain will not be there anymore, because then the pressure to the metatarsal web will reduce. Okay, but then if the non-medicamentous way is already done and the pain is still there, we can choose the medicamentous medication to treat the patient. But this patient has already visited so many doctors. Ibu sudah ke dokter mana aja, Bu?
Oh, udah banyak. Kemana?
Already a lot of doctors, including rehab doctors, including doing a lot of physical therapies, and the pain is still there. Why? Because this patient doesn't want to stay still. She lives alone. Ibu tinggal sendiri?
Yeah.
Yeah, she lives alone. She has to feed herself. She has to cook. She has to go to the market. She has to do everything by herself. She has to clean the house, everything. So then the pressure he never reduce. So that's why education about proper body mechanic is important. Because if I said that the rehab stuff should be done at the first place, it's not that way. Rehab must be included in all phase of treatment. Before we manage using medicamentos, when we do the medicamentous way to treat the patient, when we do intervention, even if then the intervention has already been done, the rehab must be done by the patient. What rehab? Not giving the patient TENS or hitting or everything else, but the knowledge about how to treat herself, her feet, so then the pain is not coming back, because this is repetitive injury to the forefoot. Okay, if the repetitive injury happens again and again and again, then the pain will be there always. Bu, kemarin saya udah bilang ya, saya obatin ibu sekarang, tapi kalau ibu nggak mau jaga, ibu alasannya banyak kerjaan, itu tetap akan sakit lagi. Ngerti ya Bu ya? I told her again. Okay, so now then, let's see what happened in the this second intermetatarsal web space. Okay, this is the intermetatarsal web space. If I flex the two like this, there will be a gap here. If I extend it, there will be a gap here. So more or less, the placement of the probe is this area. Can you see it? Moment dari sini. Yang ini aja. Ibu tekuk lutut kanan, Bu. Gini ya. So, if I flex, pegang, Bu. If I flex the toes like this, here I flex the toes, I will feel a gap here, okay? So from the dorsal view, I can feel a gap here where the metatarsophalangeal joints are. But from the plantar view, if I extend the toes, we can see here a gap. The gap is here. So this is where I will put the probe. Okay? So I will show you from the plantar view first. Okay? Here is the gap. So I press it using my left finger because I use my right hand to hold the probe. 3 fingers to hold the probe and 2 other fingers to put the probe firmly on the patient's body like this, okay? Transversely to the feet, okay? So I will see the short axis view of the metatarsal, depth-nya 2, please. Okay, so freeze. Bisa transfer ke sini? Moment, okay? So this before I show you directly in the transverse view, okay? But to be sure that what I see is the metatarsal bone. Duduk aja di bawah, jongkok. Okay. Okay. So this is the metatarsal bone, okay? So in between, this is the metatarsal web space, and here is the artery, vein, nerve bundles, okay? And this is superficial is the skin, okay? So can the forefoot of this patient again, unfreeze please. If I do it long axis view like this is the second toe. I put my probe aligned with the second toe like this. My left side is your left on the screen and your right side is the proximal side of the patient, okay? So if I move the probe distally, you see here, there's joint, okay? Freeze it, please. Okay, so this is the metatarsal bone, the head of metatarsal, and this is the second toes, okay? And this one, the gap is the metatarsophalangeal joint, the second metatarsophalangeal joint, and this one is the flexor tendon, okay? Unfreeze please. So I put my probe again here at the metatarsophalangeal joint area, okay? I want to see if there is inflammation, but before I look for the inflammation, you see here that the bone of the proximal phalanx is irregular, right? Freeze it, please. The bone is irregular here, right? Means that it is suffering from arthritis, okay? Unfreeze, please. I tilt the probe, see? The irregularity is still there. So The patient is suffering from arthritis, but the cause of the pain, freeze lagi. This is the flexor tendon. You see the fibers, okay? This is the joint, metatarsophalangeal joint, and this is the metatarsal, and this is the first phalanx, okay? This is flexor tendon, okay? Unfreeze lagi. One. Okay, and now we see here fluid collection there, okay? I will release my pressure. I will press it again, and the fluid collection disappear. I will release the pressure, the fluids come back, and then press again, disappears, and then I release it again, and the fluid comes back, okay? And then turn color on, please, going up, kotaknya ke atasin. Okay, I try to see for neovascularization, because if there's inflammation, we will see neovascularization there. Okay, increase the gain, please. Gainnya tambahin. Not always we will see the increase of, oh kurangi. Tambahin lagi, tambahin pelan-pelan. Tambahin pelan-pelan. Lagi. Okay. Kurangin. Okay. Naikin lagi sedikit sampai ada merah biru. Bukan. Gainnya. Tambah lagi. Stop. Okay, but then I must compare it to the non-inflammation area of the patient, okay? This one, she doesn't feel any pain here, okay? See, if I stay still, there's nothing, no bluish, no reddish, but here, there is, okay? So, sini, stop, freeze, okay. So, the cartilage is inflamed, the cartilage is irregular, there's fluid collection here, okay? And irregularity until here, okay? Kasih sini yang tadi dong. Review. Okay. Sebelumnya lagi. Okay. See how I press, give compression to this area. Okay. One. Okay. Stop. Now. Stop. Now the fluid collection disappearing. One. Play. Now. Play. Stop. See, when the compression is released, then the fluid collection comes back. Okay. So this is clearly bursitis of intermetatarsal web space, the second one. Okay, if I want to see for other location of bursitis, I will just unfreeze, put my probe at other sides, okay, because the complaint is at all web space, right? This is the second metatarsophalangeal joint. If I move my probe a bit to the second metatarsal web space, see, there's fluid collection. Sini. Okay, but the most prominent fluid collection is here, right? Right at the head of metatarsal, the second one. If I move the probe to the first web space, there is nothing, no collection of fluid. Depth, put the depth at the 2 cm, please. 2 cm. Bukan, depth 2 cm. Okay. And then, if I move my probe to the first metatarsal, see, Yeah, I try to release the compression. There's no fluid collection, a bit, okay? There's only a bit. But if I translate it here to the first web space, you can see also nothing. But here at the sini lagi, well, at the second metatarsal head, there's fluid collection, right? I compress it. It's gone. If I release the compression, the fluid is there again. Compress. Okay. This one. Oops. Oh, it's hot. But you see it before, right? Here, okay? Freeze, please. This is the fluid collection, right? And then look for other collection of information. Unfreeze, please. I move the probe to the second web space. Okay. There is fluid collection. I press it. It's gone. I release it. The fluid collection comes back. And if I translate the probe to the third toes, there's fluid collection also. If I press it, there's no fluid collection. If I release there is, okay? Sini dong. Sorry, ini nanya ya, perlu sini atau enggak? Kalau saya bergerak-bergerak. Here, fluid collection. And I press it, nothing. If I release the compression, the fluid collection is there. Stop. Sini, play. Review yang terakhir. Here, this is the fluid collection here. Buang. Okay, buang means I want to omit. This is the fluid collection. Okay, so it's on and off, depends on I compress it or not. Okay, I proceed to the third web space. Okay, there's a bit fluid collection. If I press it, sini will. Depthnya 2 will. Okay, there is no fluid collection, but now there is. If I release it, if I press it, the fluid collection disappear again. Okay, now I move to the fourth toe. Okay, this is the fourth metatarsal. If I release the compression, there is fluid collection. If I compress it, the fluid collection is not there. Okay, see? Okay, stop it. Review. Yang terakhir, Bill. The last one, please. Itu yang terakhir. Okay. Itu yang terakhir. Coba ke bawahin lagi. Ada lagi? Okay. See for fluid collection here. Okay. Buang. No fluid collection because of I compress it. Okay. Now I move to the last intermetatarsal area. Maaf ya Bu ya. Okay, see here. Depthnya 2, selalu depthnya 2 ya, Win. Sini, jangan lupa. Okay. Here, I compress it. A bit fluid collection. Can you see it? Only a bit. Okay, so I will ignore this one. This is the last metatarsal. Okay, I compress it. I release it. There's a bit fluid collection there. Okay, sini. Okay. Okay. So stop. Play. Okay. So the fluid collection is at the second and the fifth. The second and the fifth metatarsal. Okay. I must see the bone first. Here, the fluid collection. Okay, one fluid collection. Okay, okay. So then the diagnosis is the for the right foot is the bursitis of the second and the fifth metatarsal. So what I will do is doing interventional pain management into the this one, the most prominent site that is felt painful by the patient. Either I can aspirate the fluid of inflammation from there or not. I will give anti-inflammatory medication there, which is triamcinolone. For this small area, I will use only 10 milligrams of triamcinolone. I will use the small volume one, so I will use the 40 milligram per milliliter triamcinolone with lidocaine 1%. Triamcinolone 40 mili. Okay, so let's see how nurse Ebrina will prepare the medication, prepare the needle, prepare the patient, so then I will inject the patient. I will do the same for the left foot, but I will do it later on because I want to show you how to do it. Okay, so I will show you the first injection one only, but then we must remember that this plantar surface area is very painful if we do injection here, right? So then I must do block of the nerve that supplies the plantar area of this medial side of the foot first. This area is covered by the medial plantar nerve, while this, like our hands, okay, this first, second, third, and one half of the ring finger covers by medial nerve, while the half median of the ring finger and the fifth finger covers by the ulnar nerve. In the foot also, the medial side is covered by the medial plantar nerve, while the lateral area, the little finger and the half medial of the fourth finger is covered by the lateral plantar nerve. Both derive tibial posterior nerve. So what I'm going to do is block the medial plantar tibial posterior nerve at about 1 centimeter proximal from the medial malleolus here first, then wait for several minutes until it is quite anesthetized, then I will do the injection here, so it will help for the patient not to feel too painful when I do the injection. Okay, jalan aja, Pe. Ibu kalau tengkurap enak nggak? Ibu jangan tunggu dulu. Enggak, tunggu dulu. Ibu lebih enak kalau posisinya begini kayak tadi, atau ibu lebih suka tengkurap? Tisu dulu dong, bersihin ininya supaya nggak ngotori kemana. Oh gitu, pegal. Wait. Bersihin bukan ini. Yang kotor itu sebelah sini. Jadi, Willy tolong perhatiin yang kotor yang mana supaya nggak saya suruh-suruh. Okay. So, yeah. I'll try to do it in the prone position of the patient because usually it's the best way for me, but this is old patient. I will try to ask the patient to lay down on her tummy first. If it's okay, then I will do it that way. Ibu coba, Bu.
Ya.
Tengkurap. Tengkurap means prone. Okay. Sesek nggak, Bu? Enggak? Enggak ya? She said that she's okay with that position. Tadi yang diperiksa yang kiri ya, Bu ya. Nanti saya mau ngobatin yang sini dulu. Tapi saya mau ngobati yang sebelah sininya dulu. I give informed consent to the patient first what I'm going to do. Saya akan baalin dulu dari sini supaya nggak terlalu sakit pada saat saya ngobatin yang di sini. Satu dulu ya, Bu ya. But then to do the blocks of the tibial posterior nerve here, if my position is like this, then it will be a bit intriguing for me also. So, Bu, Telentang lagi dulu, Bu.
Ya.
I must have good position for myself, ergonomic position, as ergonomic as possible, so I will not give pain to myself. Okay. Previously, kaki kanan ya, Bu ya, bukan kiri ya?
Ini kanan.
Tadi yang diperiksa yang ini kan?
Ya.
Yeah. So I will do blocks to the medial, to the tibial posterior nerve here first. I prefer do it this way, so in supine position first, while waiting for several minutes to give the time for the local anesthetic to work. Patient will be asked to lay prone. Okay. So then, ibu mau dilakukan tindakan tadi?
Mana?
Diinjeksi?
Iya.
Yeah. Okay. So